Hello everyone, I'm Dr. Nitasha. I am a neonatologist and a pediatrician at Rainbow Children's Hospital, Banjara Hills. I'm here to discuss about one of the very common problems of the newborn babies, which is colic. So let's talk about what actually colic is. Colic is just an excessive cry by a healthy newborn baby. They can cry for 3 hours in a day, 3 days in a week, or sometimes 3 weeks in a month. And there can be any time the colic can happen, but usually it happens in the late evening and early morning hours is when we notice the excessive crying episodes by these babies. Colic is one of the very physiological phenomena which happen in most of the neonates. I would say almost 10 to 40% of the newborn babies get this problem of colic. First of all, remember, breastfeeding is not a reason for colic. A lot of mothers, they think that since they are breastfeeding the baby, that is why colic happen. No, even a formula-fed baby also can get a colic pain. But there are few precautions which as mothers you can take to prevent the colic when you are exclusively breastfeeding your babies. A lot of food products which you take always travels through the breast milk. So if you take precautions in your diet like avoiding some allergic food items, nuts, eggs, dairy products, cow's milk, seafood, some spicy food items, try to avoid eating outside food. All those things will create lesser problems in the baby in terms of colic. But be patient. Eliminating all these food items from your diet might even take some time for colic to relieve. It might take another 1 to 2 weeks for children to respond. Secondly, sometimes you might have noticed that there might be an overflow of the milk. So whenever there is an overflow letdown reflex, the baby also wants to gulp more milk. Along with gulping this more milk, they gulp lot of air, which is the main reason for colic. So what you can do is 2 things. One is you can express your milk before directly breastfeeding the baby. That will relieve a little bit of extra pressure from your breast and baby will be able to feed comfortably from your breast. Secondly, you can also try a little bit of reclining position while breastfeeding. That will decrease the effect of gravity and decrease the pressure of the milk going onto the baby's mouth. One more thing which you remember is the overabundant milk supply. Whenever you have a more milk supply, the fore milk is thinner and the hind milk is more rich source of fats and proteins and vitamins. So if the baby is just sucking at your breast for first 5 to 6 minutes and leaving the breast and is getting sufficient milk, mainly your baby is getting more of water or lot of gases. This causes also colic. So what you can do is don't switch over the breast. Feed on one side comfortably for 10 to 12 minutes and if the baby is satisfied, let the baby go to sleep and then go to the next breast when the baby wakes up. This will prevent the cluster feeding and going lot of fore milk into baby's mouth and stomach and hence it prevents colic. It typically begins when your baby starts becoming around 2 to 3 weeks old and it can be present till 4 months and for some babies it can be there beyond that also. But don't worry, colic might be a very frustrating experience sometimes as parents or as mother for you, but it usually does not have any long-term consequences on the baby. Last but not the least, I want to discuss with you as mothers or as parents how you should cope with this colic. Since nobody knows what is the cause of colic and the treatment itself is a mystery, there are a few important things which I want to tell as parents which you can do while coping with this colic. First is respond to your child quickly. Some parents think that if the baby is crying excessively, they should try to ignore or avoid the cry and baby will stop crying. It does not happen like that. Rather, by addressing your child's needs quickly, they will feel more secure and more safe that their needs will be addressed faster. Other things which you can do is burp your baby well, breastfeed more, swaddle your baby. You can try to do a little bit of massage on the tummy and put your baby on your shoulder. The baby's tummy on your shoulder will give them a lot of relaxation. Reduce the stimulation of your baby, like trying decreasing the noise around your baby, trying decreasing the sounds of the TV, decreasing the light around the baby. Completely dark and soundless room is not required, but decreasing the stimulations will give a calm and a comfortable place for baby to sleep and handle with colic better. And take care of you too, because continuous excessive crying of the baby can be sometimes very frustrating and emotionally and physically challenging for you. Be kind to yourself. Take a break, take a nap, whenever possible for you, just walk away. It may seem like this is a never ending process and colic is never going to go, but thankfully colic does go away. It just takes a little time, love and patience. If you're ever uncertain about it, you feel no, it's not a colic or something else, don't forget to reach out to your pediatrician.